I'm Mike Royer with an extended interview in this Health Matters Web Extra. Welcome to this edition of Health Matters. Our guest today, a familiar face, Dr. Thomas Weida, the Chief Medical Officer at University Medical Center. Dr. Weida, good to see you.
Good to see you too.
We are approaching a year of first hearing the word COVID, coronavirus. I first heard of it in March, maybe February last year. When did you first hear about it?
Around February is when, and then March is when it really hit.
Yeah, what a year it's been. Textbooks and papers are going to be written for years about this. On our segment today, we want to just talk generally about COVID, where we are. Often with you, I've asked about light at the end of the tunnel. There is some optimism now. Vaccines are being given. They're going into the arms of people. Are you daily, weekly, feeling better about the progress we're making?
Yes, I think vaccines certainly will provide a good solution to this problem that we're having. It will be a preventive measure that will decrease transmission among folks, and that way, that's how we're going to stop this pandemic.
If you read last week's newspaper, it may be outdated when it comes to COVID-related issues. There's new information every day. Let's talk about some of those. Dr. Fauci, in recent days, has suggested it may be a good idea to double mask. Makes a civilian like me wonder, well, maybe we should triple mask or wrap cellophane around our face. There's new information on safety all the time. The double masking, I guess, makes sense to most physicians.
Double masking makes sense, particularly if you're using a cloth mask.
Yeah.
I think double masking makes sense. If you're using a surgical mask, I'm not sure you'd have to, or a KN95 mask that fits well. Again, you may not need to double mask, but the cloth mask, one layer is not sufficient. So doing two layers makes a lot of sense.
Most of us don't have ready access to N95s, the kind that you want your frontline people to be using. It doesn't matter what kind of mask you have if it's not fit properly, and most of us just throw them on and don't think much about that. We should think more about fit no matter what kind we're using.
I think fit's important. The other thing that I see is that the mask doesn't do any good if it's below your nose.
Yeah,
and so many people, it slips down and while they're talking, and really that's not as effective. So you need a mask that's going to cover both your nose and mouth.
I know you're tired of saying it, and maybe people are immune to taking it seriously, but still the masking, washing hands, keeping your distance from people, that's one thing in this story that hasn't changed at all.
Correct. It's the ABCs of pandemics. Mask it, wash your hands, keep social distance.
Are symptoms about the same when people are tested positive, are symptoms still ranging from, well, that young person hardly had any symptoms at all, to some young people who do, to people who are very ill and have to be hospitalized? Have we seen any difference in the effects of the virus once someone is positive, or is it that fairly consistent?
The symptoms are still pretty much the same. They could be mild or they could be very severe. Certainly that loss of taste or smell tends to be a factor that I go, yeah, that person probably has COVID. What I'm seeing, though, lately is that folks who are getting significant symptoms, they're lasting longer. So they're feeling tired or having congestion or having the problems with smell or taste lasting beyond the traditional 10 days. And so that makes it more difficult to get people back to work.
You've said in previous interviews that symptoms vary from person to person, but if someone says, Dr. Weida, I can't taste anything, you almost think you don't even need to do a test. You are probably positive.
Yeah, if you tell me you can't taste or smell, whether the test is positive or negative, I'm feeling you've got COVID.
Share with folks watching today your thoughts about the variants that have shown up in other countries and now in some parts of the United States. I believe one person in Alabama has died tested with one of the variants of the COVID vaccine. Where are we in understanding more about that?
Well, there are mutations, and with any virus, there are mutations. Think the flu virus, all sorts of different strains of that have mutated over the years. And with COVID virus, they're mutating. Now, some of those mutations won't be any different. Some may be more infectious, which the Great Britain or UK variant seems to be more infectious, so it's easier to get it. Others may be more serious, and they're worried that the South African type virus may be more serious, causing more significant symptoms for people. So it depends. Now, hopefully, the vaccines may be able to prevent all those different variants.
And that's a learning curve as well. people who have had one shot or two or whatever vaccine they end up with, we may have to, like we do with the flu, get booster shots to either handle variant or a new strain. We're not going to just get our shot and then go home and forget about COVID. This is going to be something we're going to have to deal with years going forward.
Right. We're going to need to watch the variations, watch the response to vaccine, and even I see a few patients, not a whole lot, that actually get COVID more than once. And what may happen there is that they don't mount a very strong antibody response. Maybe the first time it was a very mild illness, and so a second COVID infection can happen, or perhaps a variant.
In future Health Matters segments, we're going to talk to you specifically about vaccines and vaccines exclusively. Let's end on this positive note. How remarkable is it that we've been getting flu shots for as long as I can pretty much remember, and I'm always told, oh, 50, 60% efficacy, you shouldn't get the flu, but you still could. And now we're giving vaccines for COVID that have proven to be better than 90%, up to 95% positive. That's pretty remarkable.
You're right. The new vaccines are very remarkable in how effective they are. 95%, that's a great rate. And so it really means that we have a good handle on trying to prevent this disease from spreading in the future.
Dr. Thomas Weida, Chief Medical Officer at University Medical Center, thanks for the update. We'll look forward to talking to you more in the future about COVID and other health-related items. Thank you.
Thank you very much.